This is Harold H.B. Bell, live on The Spectrum, and The Spectrum is a podcast and information portal to give you as much information about autism spectrum disorder. I am here with Dr. Jane Yip, the proprietor over at Autism Parent Care, and we're working together to try to make this information as easily and accessible as possible to families who are dealing with children on the spectrum. And Jane, we were talking about early diagnosis in the last video, but to know is one thing and to get treated is another thing.
Correct.
And so we start talking about diagnosis and treatment and the gap in between. Talk about that fatal flaw that families make.
Okay, that will be a sociological question, right?
Yes.
Getting diagnosis, getting a label is only the beginning of the journey. Now, according to sociological research, there is a gap between diagnosis and getting treatment, not only for autism, for most other mental health conditions. Because one of the findings in this research shows that people who are communities, right, who are colored, such as African Americans, Latinos, not so much Asians, but nevertheless, certain communities.
Haiti. Anything that we want to talk about from, the islands or people of color seem to.
People of color seem to be hesitant to send their children to providers who are mainly Caucasian. There is an ethnicity gap. Now, this is not my opinion. This has been demonstrated in research. So we need providers of colors to serve these communities. And there are social cultural aspect, and there is a stigma associated with mental health disorders, and autism is no exception. So the family perhaps feel embarrassed to go forward and ask for help. And these communities tend to think that they should be taking care of things themselves, and visiting mental health providers tend not to be in their cultural repertoire.
Now, and I want to address this because Dr. Yip and we have diligently gone out and created the Urban Autism Initiative, and it's not anything other than a reason to plant this information into cultural areas and neighborhoods that might not have this information, and have it exposed to by somebody that looks and sounds like them. I mean, we just have to be frank about this. We're talking about wanting someone to go to the mental health doctor, and only 2% of the doctors look like the people who are going to get the help. They're not going to go. So I just want to thank you on there for allowing me to go out and share this information with communities who are in desperate need to know about early treatment, early diagnosis, and everything included. We talking about early treatment, and you mentioned earlier on in one of our other series about how productive this can be for children with ADHD, ADD, nonverbal children if we start getting this treatment early, and that mind's ready to receive the treatment that we're giving. Talk about the difference in treating a 4-year-old, because you had an experience with a young lady that you shared with me that was 4 years old, nonverbal, and now she's like the leader in her class, so to speak.
Yes, actually I started with this young lady, actually 5 years old. She is minimally verbal, which means she speaks maybe a sentence here and there, but hardly. It's more a question answer. Ask her a question, she will give you a one-word answer. 2 if you are lucky. And she's very shy. She roams around in class crying because she's lost. She does not understand the social landscape. And it looks like she has ADHD because she has difficulty focusing. She doesn't know what to focus on. And she's just lost. The whole world is too noisy, too crowded, too overwhelming for her, and also the instructions that a typical teacher gives, right, is vague. Sit here, turn to this page, tell me what it says. She cannot tell you what the story says. She doesn't really know what you are asking. So she was crying when she came to us, and in 2 years' time, yes, true enough, she is able to not just do a question answer. She started off with her mom baking a cake. She would ask her mom for things that are not there, because we teach that kind of thing. Mom, you need this, you need that. and then she'll give mom ideas of what kind of cake she wants to make. And then gradually it continues to being able to tell her mom what happened to her with us in school. And now she is in a mainstream classroom. Several years later, her mom actually sent me photos of her doing drama. Now, for somebody who started off really being shy of everybody to standing in front of a crowd doing drama and being really happy about it, that is a significant improvement. And in fact, I would like to say yes, even though we cannot cure, but that is sure close enough to recovery.
And that's what we're hoping to do, and that's the reason we know this early diagnosis, early treatment works. We've also got another young man out here that you got when he was 4 years old, nonverbal, and he's a typical bad little 9-year-old kid, but this kid is he's so bright and light.
He is. We used to joke with the parents, you know what, you want us to teach him to talk. Yes, we are not responsible for the content of what he says. He debates. And we also joke that this is, what do you call that? Maybe a lawyer in future. He will debate, he will argue, and he's definitely verbal now.
And he's a 9-year-old boy, and that's what I'm talking about. But I only can imagine, had we not picked him up at 4 years of age and picked him up at 9 years of age, and then how thwarted his growth probably would have been.
So on the flip side, if we did not give him intervention, right?
Yes.
These two children that I mentioned, that girl who was crying will still continue to cry. And in fact, she will be worse because she will have been older now. She will look around and she would see that there are so many other things that she cannot do. All the life that she cannot live, right? How sad it is for her. And the other rambunctious boy, look, we love his debating skill. We might have a top lawyer with us one
Absolutely.
day, and we would definitely prefer him that way than him not realizing that potential of his. And I tell you what, the impact on the family, when the children does well, the family is happier, and the downstream effect is just priceless. So please, treat it early. Do not be shy about the stigma. Do not worry about the stigma. We are here to show you that it's okay. It can be done.
Absolutely, and that's the reason we're trying to give you all this information on the spectrum, and early treatment is so important. But the treatment that we're giving is not a mystery. It's a science, but it is not a mystery. And in the next segment, we're going to tell you some of the things that you can do to take home and get some of these best practices that we're applying here at Autism Parent Care. You've been listening to The Spectrum.